After laying the groundwork with a lot of information about blood pressure, I will now formally discuss the blood pressure standards for hypertension, i.e., at what point your blood pressure is considered high. According to standards set by organizations such as the American Heart Association and the American College of Cardiology, blood pressure is typically categorized into 4 main groups. The first category is normal blood pressure, defined as a systolic blood pressure below 120 millimeters of mercury and a diastolic blood pressure below 80 millimeters of mercury. This is the ideal blood pressure range for the human body, indicating that the cardiovascular system is in good condition. Children and young, healthy individuals generally fall within this normal blood pressure range. The second category is prehypertension. The criteria for prehypertension are systolic blood pressure between 120 to 129 millimeters of mercury and a diastolic blood pressure below 80 millimeters of mercury. This range is at the upper limit of normal blood pressure. Here, I would like to clarify that systolic and diastolic blood pressure do not rise or fall simultaneously. For many young people with hypertension, both systolic and diastolic blood pressure often rise together. However, for many elderly individuals, the systolic blood pressure increases while the diastolic blood pressure may remain normal or even decrease. This condition, where systolic blood pressure is elevated while diastolic blood pressure is normal or decreased, is referred to as isolated systolic hypertension. This term was also mentioned in previous videos.
As one ages, one's heart tends to enlarge slightly, and the artery walls and arterioles become thicker, and then the elastic tissue within those walls and arterioles is lost. So a condition that appears regularly in the elderly is something called isolated systolic hypertension.
For the second category of prehypertension, although the diastolic blood pressure remains within the normal range, the systolic blood pressure has increased, indicating that the cardiovascular system is under increased stress. This is a precursor to hypertension, and the risk of cardiovascular disease begins to rise. Some subhealthy individuals aged 30 to 40, such as those who are obese, sedentary, lack exercise, have unhealthy diets, or experience high work stress, generally fall into the prehypertension category. The third category is stage 1 hypertension, with systolic blood pressure between 130 to 139 millimeters of mercury or diastolic blood pressure between 80 to 89 millimeters of mercury. At this stage, blood pressure is considered mild hypertension and risks begin to emerge. Increased pressure on the heart, blood vessels, and kidneys may lead to complications such as heart disease, stroke, and kidney disease. Many middle-aged individuals with unhealthy habits like smoking, drinking, and a high-salt diet are at risk of developing stage 1 hypertension. The fourth category is stage 2 hypertension. The criteria for stage 2 hypertension are systolic blood pressure of 140 millimeters of mercury or higher, or a diastolic blood pressure of 90 millimeters of mercury or higher. Stage 2 hypertension is classified as moderate to severe hypertension. At this stage, the cardiovascular system is under increased strain and the risk of organ damage significantly increases. Most middle-aged and elderly patients with hypertension fall into the stage 2 category. The above are the 4 common types of hypertension, but there is also a more severe form known as hypertensive crisis. Hypertensive crisis is defined as a systolic blood pressure of 180 millimeters of mercury or higher and a diastolic blood pressure of 120 millimeters of mercury or higher, which is classified as extremely high blood pressure and represents the most critical state of hypertension. This blood pressure level can lead to acute complications such as heart failure, stroke, retinal damage, kidney failure, and even death. Hypertensive crisis requires emergency treatment.
8th time's the charm.
You trying to piss off Foreman?
Just let...
BP's 240 over 140.
Turn that thing off, will you?
Take the needle out. Take the needle out.
Hey. It's a hypertensive crisis. Start her on IV low pressure drip, titrate to